सुसेगाद दंपार पडणारांक म्हजो मायमोगाचो नमस्कार. हांव फ्रँकी फर्नांडीस, मेलबर्न, ऑस्ट्रेलियासून तुमकां ह्यो गोंयच्यो खबरो कोंकणींतल्यान पावयता. आज जुनाची 13 तारीख. सुरवातेक एक दुखेस्त खबर गांवचो म्हापसा हांगासून. हाचें कारण म्हणल्यार बेकायद्याची सोशल मिडिया. 22 वर्सांचो तरणाटो हाणें सोशल मिडिया हाचेर लॉस जाल्ल्या उपरांत आपलो जीव घेतलो. खबर मेळ्ळ्या ते प्रमाणे कोण एकल्यान हो तरणाटो हाका गार्बेज रस्त्या सायडीर उडयता तो व्हिडिओ काडलो आनी हो व्हिडिओ व्हायरल केलो. कांय गोंयचे न्यूज चॅनल हाणें बी हो व्हिडिओ व्हायरल केलो. हाचे उपरांत म्हापशेच्या पुलिसांनी चवकशी करपाक ह्या तरणाट्याक आनी ताच्या फॅमिलीक आपयलो आनी 7 वरां उपरांत FIR रजिस्टर केलो आनी तांकां धाडले. हाच्या उपरांत ह्या तरणाट्यान आपल्या घरा वचून आपलो जीव घेतलो. गोवा मेडिकल कॉलेज हांगा पोस्ट-mortem केल्या उपरांत गोमन आयलें की ह्या तरणाट्याचेर 2 म्हत्वाच्यो इंजरीज आसल्यो आनी ह्यो इंजरीज ताणें आपलो जीव घेवच्या पयलीं जाल्ल्यो आनी आतां फॅमिलीन आरोप केला की ह्यो इंजरीज ताका पुलीस हाणें मारल्या उपरांत जाल्यो म्हूण. हो विशय आतां पुलीस हाचें एक्शन अदीक करून प्रश्न उठ्ठा की ह्या तरणाट्याक पुलिसांनी पयलो मारलो काय म्हूण. आल्दोना गांवचो काँग्रेस पक्षाचो आमदार ॲडव्होकेट कार्लोस आल्वारेस फेरेरा सांगता.
The FIR is registered at 9:30 in the night. So why did you call him earlier? What kind of a grave offense? Was it murder? Was it rape that you needed him immediately or in some custody? Do you have any evidence which you collected from the site to corroborate that he had actually thrown garbage which belonged to him or which he brought, biodegradable or non-biodegradable? And what kind of inquiry or was being conducted before registering the FIR of such kind of a matter which is a petty offence? I think that the action first of the man who took the video was completely wrong, both in filming the video and uploading it and making it viral on social media, as also the channels which sought to broadcast this video by clearly disclosing the face of the youngster. Why I say disclosing the face of the youngster? If at all the video showed an actual crime being committed, it would have been one part of it. But even criminals, the Supreme Court has recognized that even criminals' face cannot be shown because they are not criminals in the sense that unless they are proved guilty, they should not be shamed first in advance. In the sense that they should not be shown to be proved guilty before they actually proved guilty. So therefore, the important question comes is when you have no evidence of him throwing, when you have absolutely no data what kind of garbage he has thrown, you make a video and you share it and you already hanged him before he has actually even been booked, before he has even been tried and sentenced and he has been convicted. How can that be? I think this case requires investigation. I demand that since there will be officials, multiple officials of the police station involved in this matter, this complaint now involving the harassment and the consequent death of the boy should be referred to the crime branch, transferred to the crime branch. It cannot be conducted by the Mapusa Police Station because the Mapusa Police Station will not give justice, may try to cover up the tracks and may try to protect one of their own flock. And I believe that justice will be served when all these kind of actions are taken to a logical conclusion, and it must be done expeditiously.
खबर बिचोले कारापूर गांवांतसून. गेल्ल्या सुमारांत आमी दाखोवन दिल्ले कशे तरेन वन ग्लोबल गोवा, द हाऊस ऑफ अभिनंदन लोधा हांगा मेगा हाऊसिंग प्रोजेक्ट बांदतात आनी हाचें काम जोरान चालू आसा. हाचे उपरांत रेव्होल्युशनरी गोन्स पक्षाचो सांत आंद्रे मतदारसंघाचो आमदार विरेश बोरकर हाणें गांवच्या लोकांक ह्या प्रोजेक्टाचे विरोध करतल्यांक तेंको दिलो आनी मुखेलमंत्री तशेंच टावन आनी कंट्री प्लॅनिंग हाचो मंत्री हांचेर निशेध मारला.
गोंयकारांक डुलो मारता हो लढो जो आसा हो 65 डेज दूख दिसता म्हाका. गोंयांत अशें इतिहासान पयले फावट दिसता म्हाका 65 डेज एक गांवचे लोक जे आसा ते प्रोटेस्टाक बसता, पण सरकारान दोळे बंद केला. आता सरकाराचे दोळे उगडुपाक गोंयकारांक उठचे पडटले. समज गोंयकार उठना जाल्यार अशे गांव जे आसा, कारापूर आयज आसा, फाल्यां दुसरे गांव आसतले, आणि तुम्ही 39 एजच्या अंडर तुम्ही पळया कितलेशे तेंच्यांनी गांव नष्ट करपाक दवरिल्ले आसा आणि प्रत्येक गांवच्या लोकांक उलो मारता की भायर सरा. आयज आमी भायर सरना जाल्यार गांव सोंपयतले, गोंयकारांक सोंपयतले आणि गोंयकारांचें अस्तित्व जें आसा ते काबार करून उडयतले. आमी कारापूर लोकां वांगडा सदांच आसतले. गोंयकार खंयचे आमकां उलो मारतात त्या गोंयकारांकडे आमी वयतले, तांकां अवेअरनेस करतले आणि हे जे प्रोजेक्ट हे डिपार्टमेंट हाडटा मिनिस्ट्री हाडटा जो सरकार हाडपाक सोदता तेजो विरोध करता. 65 डेज जाणटे तरणाटे जावं भुरगे थंय बसता दीस रात आपलो एक करता फक्त गांवाक लागून आणि जेन्ना ते बसता तेन्ना एक जबाबदारी ह्या बीजेपी सरकाराच्या आमदारांनी जावं मिनिस्टरांनी घेवपाक जाय की बाबा तेंचे विजीट करपाची जावं तेंचे अंडरस्टँड जावपाची. आयज हांवें ह्या वाटिका खासदाराक तिकाय सांगलें बाबा मी इतले सगळे चलता 65 डेज चलल्या पण त्या 65 डेजाचो एक दीस पासून तुम्ही वचून थंय पळोवंक ना बाबा थंय कितें आसा कितें चाललें. तुम्ही ती वचून ती सायट विजीट केल्ली आसा त्या सायटीचेर पळयल्ली आसा म्हणून ती म्हणपाक लागली आमकां खबर ना आपण आय हॅव टू सी द पेपर. आता आय हॅव टू सी द पेपर सच अ बिग प्रोजेक्ट आख्खे गोंयभरान सगळ्यांक व्हडलो प्रोजेक्ट आमी म्हणूंक शकता 5.5 लाख स्क्वेअर मिटरचो प्रोजेक्ट जेन्ना गोंयांत येता आनी हांगा चीफ टावन प्लॅनर अशें सांगता की आय हॅव टू सी द पेपर म्हटल्यार कितें इतलेंच कळटा की आयज आमच्या सामान्य बारीक समाजाच्या लोकांक तेंच्यांनी सायडीक मारलेले आसा तांकां पडलेले ना बट ह्या व्हडले व्हडले बिल्डर जे आसा लोडा सारखे बिल्डर जे आसा ह्या बिल्डरांक ते माथ्यार बसयल्ले आसा आनी तांकां घेवन नाचता.
गोंयकारांक एक व्हडवी कांयची खबर. गोवा मेडिकल कॉलेज हांगातलो एसिस्टंट प्रोफेसर डॉक्टर अमित डायस हाका संवसारभर मेडिकल सायंटिस्ट हातूंतलो 5वो स्थान फावो जाला. डॉक्टर अमित डायस जावन आसा एसिस्टंट प्रोफेसर डिपार्टमेंट ऑफ प्रिव्हेंटिव्ह एंड सोशल मेडिसिन गोवा मेडिकल कॉलेज हांगा. आल्दोना गांवचो डॉक्टर अमित डायस हाणें अंतराक्षित माचेर डिमेन्शिया, हेल्थ एजिंग, मेंटल हेल्थ, डायबिटीज अशी दुयेंसांचेर रिसर्च केल्या आनी गोंयांत डिमेन्शिया सोसायटी ऑफ गोवा ही बी स्थापन केल्या.
Research is a journey, and I'm not there yet. I'm in the top 5% scientists. But what this news, it really came as a very pleasant surprise. हांव अजापलो जेन्ना हांवें हें आयकलें, and I'm really humbled to know that the work that I am doing is really impactful. I didn't even know somebody was rating me on this. But it gives, because research is something you're sometimes working on uncharted territories. You don't know what's going to be the outcome of what you're doing, but there is a research question in your mind and you want the answers to that. And one thing led to another, because when I started my journey, it was when I was doing my thesis on Alzheimer's disease in the state of Goa to find out, does Alzheimer's exist in the first place? How are people taking care of people with Alzheimer's disease? What can we do for them? Can we prevent dementia? So all these, one question led to another, and that was really a very smooth journey that I had. On the way, I did a lot other research on chronic diseases, because Goa is changing. We have a very aging population. At the same time, we have managed to control infectious disease to quite an extent. We managed to keep our infant mortality rate, for example, is very, very low. We are rated as one of the states that can compare the indicators to the rest of the developed world. But there are problems in Goa that are inherent in Goa, and we need to look into that, and research helps us do that. Now, what this rating did is one, it gives me the feeling that I'm on the right track, which is very good. At the same time, more than anything else, I was really overwhelmed with the fact that so many people appreciated that. And I got messages from around the world appreciating the fact that I am rated as one of the 5 top scientists in the world. And that encourages me to do more. And that also is a reminder for me that I'm not there yet. अशें दिसता की म्हापशा वचपाक सोदता आनी 5 किलोमिटर आसा म्हापशा पावपाक. म्हणजे I have not reached my destiny as yet, but I'm somewhere close, and people appreciate the fact that I'm close, and it's making an impact on other people. More than that, I've been teaching in the last 25 years at the Goa Medical College, and we have so many students. If we have to change things, I always say this. For example, if you're taking a paracetamol tablet today for your fever, how do you know that paracetamol is meant for fever and it's going to make an impact? It's because someone did research. What we know today about medicine is because someone in the past has done research and given this to us on a platter. If medicine has to improve in the future, which it is doing, then we need to contribute to this. आमच्या स्टुडंटान रिसर्च करून मेडिसिनाच्या फुडाराक कॉन्ट्रिब्यूट करपाक जाय. So we have to contribute to this, and the only way that you can contribute to this and develop evidence and evidence-based research, and evidence-based research that is good quality, that can impact policy, is by doing good quality research, understanding the methods of how to do research. And that's what I've been doing for the last 25 years. And I'm happy that this suddenly came as a surprise to me, but it's telling me that that I'm on the right track and I have miles and miles to go. Goa is unique in many ways, and in fact, when I was doing work on Alzheimer's disease and dementia, my work showed that 90% of the people with dementia in the state of Goa didn't get help. So there was a huge treatment gap. It's because of lack of awareness. They didn't know this was a disease. They would look at it as normal aging. Sant zalo ni काय करूंक जायना कितें करया आतां टायम जालो ताजो अशें दिसता. So we can do a lot. In fact, the research that I was doing showed how we can do a lot. The interventions can actually improve the quality of life of a person with dementia. The interventions can actually manage burnout in the caregivers of people with dementia. And there's a lot that I learned. In fact, I had come to Australia for a conference, and there was a lot of network that we did over there. And we learned from the models from Australia on how we can actually adapt these models now for the state of Goa and reach out to people. And that's what we did. In fact, the work that I had developed on interventions for people with dementia won the International Award for being the best evidence-based psychosocial intervention for people with dementia. And this is something that we would want everyone to follow and get the benefit of research. And recognition like this sometimes brings the focus back, and that's what I'm really happy about. It brings the focus back on the cause that you're working for and your mission. And if something leads to in a way that we can actually get this information to everyone else to develop this further, there's nothing like it. The other work that I did was with the ICMR, the INDIAB study, which is one of the largest studies on diabetes in India. And it showed that Goa had the highest prevalence of diabetes. 26.4% of the people above the age of 20 had diabetes. And there is a lot more that we need to work here. And as I said before, we have managed to control infectious disease in the state of Goa, but chronic diseases are on the rise. Lifestyle diseases are on the rise. And so we are having problems that the developed countries have. So we have problems related to aging related issues. So it's a good thing that people are living longer, but it's just a wake up call for all of us that we need to do more for this section of society. Can we do more for prevention? Because I'm from the Department of Preventive and Social Medicine, and my main focus has always been on how we can develop better models for prevention. Now, speaking of that, there was a study that I did called the DIL study, and this really stands for depression in late life. How can we prevent depression in our seniors? And simple interventions by trying to address the issues of sleep, trying to get them empowered to take care of their own health issues, trying to do something what is called problem solving therapy, and trying to help them understand what their problem is and address it. And what we did is we followed them up for a year, and we found that was a big impact on being able to prevent depression in older people. And so that's really, that the paper was published in the JAMA. And all this research that I did contributed to, the recognition that I got. And so it just feels very overwhelming. And it is something that we need to work on further and do better. And probably network with people around the world and Goans around the world. And speaking of that, again, I also remember the contribution of Professor Ralph Martins, just from Australia, from Perth. And he has Goan roots, and very nice gentleman. And he invited me to Perth, to the Edith Cowan University, for a fellowship on prevention of dementia. And that actually inspired me further to work in this area. And I was invited by the Lancet, part of the Lancet Commission on prevention of Alzheimer's disease and dementia, which was published. And we identified what are the factors that can prevent dementia. And this is really a game changer, because if we want to change the trajectory, dementia cases are rising year by year. And if you want to change that trajectory, we have to prevent the disease right from. So it's just a lot more to do. Now, what is my message to the global Goans? First of all, thank you. But I'm sure that my work is just a drop in the ocean, and there are many more drops around, bigger drops around the world. We should, I think, network. There's a lot that we can learn from each other, and if we can build capacity, there's nothing like that. Capacity to do research, capacity to come out with, to think of various other angles to the situation that is happening in the state of Goa, and how we can address this. And if there is any way that we could network, I'm sure the government of Goa will be very happy to encourage such a network and grow in research, such that we can give back to the people of Goa and make Goa one of the top model states, and come up with the best outcomes for the state of Goa. So once again, thank you to all the Goans, and तुमचो मोग म्हाका मेळ्ळो म्हूण हांव आभारी, आनी म्हजो नमस्कार सगळ्यांक, आनी देव बरें करूं म्हूण.
तर ह्यो जर असले आमच्या सुसेगाद दनपार गोंयच्यो खबरो मेलबर्न ऑस्ट्रेलियासून. मेळुया दुसऱ्या सुमानात, ते मेरेन मोगा संदी.